from the Kansas Department of Health and Environment, Steve Corbett. Please join me in welcoming Steve.
Yeah, Steve Corbett. I'm a senior epidemiologist at Kansas Department of Health and Environment, where I'm also the director of population health, maternal child health, and chronic disease epidemiology. I'm going to give you a real fast overview of easy to use data sources that you can use that will provide you usually with information at the sub-state level, so regional, county, census tract, zip code, because that's usually what community organizations are looking for and tend to struggle to find. So I'm going to go through this really quickly, but we'll make these available to you. The links that the sites that I'll talk about are linked in the PowerPoint presentation, so you'll probably get more from actually looking at the presentation than actually listening to me. So these will be made available to you. Okay, so the first sources that I will provide to you are primarily from Kansas Department of Health and Environment. So I'll go through a few of those that we have available and then talk about some national resources. One that has a lot of data in it that's available every year. We have the annual summary vital statistics that comes out of the Office of Vital Statistics. So marriage, birth, infant mortality, general mortality, things like that are in here. It's usually a PDF form, but it's easy to find on the website. Just not as easy to use if you want to like download data or use data in that way. But there's lots of data here. For downloading data or getting electronic versions of data, a lot of this data ends up in the Kansas Health Matters website. This is a really good website to use because it's KDHE data as well as data from the Kansas Hospital Association and several other state organizations from around the state. So really good site to use. It's got data on demographics, social determinants of health, key health indicators, things like that. So it's readily available, lots of stuff, very easy to use. You don't have to do much with it. You go to where you need the data, you go to it, it's there. You don't have to do any kind of real work afterwards. They also have, at Kansas Health Matters, these what's called the Socio Needs Index Suite. These are sites that provide data on the Health Equity Index or the Food Insecurity Index and the Mental Health Index. These are, again, all at the either county, census tract, or zip code levels. The indices themselves are proprietary. The company that makes them won't exactly tell us exactly how they do it. Most community organizations don't care. EPIs care. People like me, we care because some people ask us questions about it. But in most cases, you can use this without too much trouble. Kansas Information for Communities. I don't know if anybody's ever heard of KIC, but that's what it is. This one's a little bit more difficult to use only because it's a query system, but it has a lot of the same data that you'll find in Kansas Health Matters. It's kind of an antiquated system. It does have birth statistics, pregnancy, death statistics. We don't currently have the cancer statistics on there. We had some technical issues with data suppression. We're hoping to maybe get those back on there or develop our own cancer statistics website. Lots of good information if you're comfortable with using a query system. So the data isn't readily available there when you just go to a page. You have to actually ask it what you want. This is going to be a really good site to use for KDHE data dashboards. So on the KDHE website, we have this page that has all the dashboards and data sources listed alphabetically in an index. So all you have to do is if you're looking for asthma, you go to A, you can find asthma data, click on it, and it'll take you to either a website where you can download some of that data, or in most cases, it's a data dashboard that's interactive. And I'll show you some of the sites, not all of them. Like I say, it goes through A to Z. I think there's something for everything. I'm trying to think if there's a Z. Yes, there is, zero suicide. So there's data all through this. So it's a good resource, a good place to start to find state-specific data. One of the newest sites, this site was released on Tuesday. So it's brand new. It's the Behavioral Risk Factor Surveillance System data. This is prevalence data. So if you want to know how many people have diabetes or have asthma or smoke or binge drink or do anything like that, what is the number, then you want to go to BRFIS. BRFIS has data for many of the counties, not all of them. When we don't have county data, we have regional data. We're currently working on updating our regions. We've got a lot of feedback from counties in particular saying, well, the regions are kind of, they're too big, there's too many counties, or you're putting a big county with a little county, you shouldn't do that. And so we're trying to redo these so that the counties that are grouped together to give us a good enough sample so that we can provide data are complementary to each other. Okay? So this is brand new. I don't even know, I haven't even been able to check and see if anybody's on it, so you can still win the prize for being the first person. I don't know what the prize is, but you can win it. I mentioned some of the problems we're having with the cancer data on KIC, so we're also developing a cancer data dashboard. This will be released in September is what we're looking at. It'll have data on incidence, mortality, as well as prevalence. So this is the cancer, we have an actual registry, cancer registry in the state of Kansas, and so registry data will provide us with incidence and mortality. The prevalence data actually comes from Behavioral Risk Factor Surveillance System, BRFIS, the one I showed you before, but it's got a little bit more data on cancer screenings and prevention and things like that. So there's another one that'll be new, it'll be coming out really soon. Again, data at the county level, where county level data is available, where it's not, we have regional data. Okay? These are usually the best sources of data to go to if you really want to get accurate information. Most of these other sites that I'll show you are copying from us. Okay? That's where they get their data. Trends in maternal child health. This is from the Maternal Child Health Program. It has lots of data. It's tons of data at the statewide level. Just an extremely long list of all kinds of data, but most people, again, want, small area estimates for counties and things like that. We do have some county health indicators, adolescent mortality, early term birth, preterm births, things like that. So there is some data available at the county level for maternal child health measures. Anybody interested in environmental health? So we have Kansas Environmental Public Health Tracking website, which combines data on health conditions, socioeconomic factors, and environmental factors. So you can look up the relationship between something like air quality index, what is the, PM 2.5, if you know what that is, and relate it to asthma or something like that, right? So again, we have county level data for this. Some of it's modeled because it's hard to get something like air quality data for every point in the state. Not everybody has an air quality monitor. But it's pretty useful and covers most of the state. And it'll indicate if it's modeled versus actual data, if you care. Again, EPIs care. Sometimes people just trying to write a grant don't care so much. Division of Environment also has this website. They plot environmental issues around the state, whether it's a Superfund site or it's a leaking underground storage tank or a place where they used to have dry cleaning supplies, things like that, things that are considered environmental hazards. They can be, they're mapped throughout the state. If anybody was ever interested in looking what's going on in their neighborhood or their community, they can go here and see it. It's publicly available. Syndromic surveillance, this is used for real-time data, what we call, epidemiologic surveillance. This is what's going on almost today. This is updated weekly. So this is real-time data that we get on a daily basis through syndromic surveillance system. So we're getting hospital data and emergency department data. And so it's not always the cleanest data, but it is going to tell you what's going on really within the last week, because that's how often this particular dashboard is updated. Information on respiratory visits, gastrointestinal visits, mental health visits, overdose. The seasonal visits ones can be just kind of fun to look at, particularly after like the 4th of July, to see how many people had to go to the hospital for burns or things like that. You get, heat stress. You can look at it. It's been a hot day. How many people had to go to the hospital for heat stress? Or it's been cold. How many people slipped and fell? You can actually see this in real time, going up and down. We also have, the data is also available at the county level for this. This is another one of the dashboards that is linked to the index, the data dashboard index that I showed you before. This is drug overdose death rates. Again, there's county level data where available. Okay. This is the suicide data dashboard. Again, we have county level data where it's available if the numbers are high enough. Usually we try to have numbers that are over about 6. Okay. Violent death reporting system. Oh, is there a question? Yeah, go ahead.
On the syndromic surveillance program, you said updated daily.
We get it updated daily.
Can you do? Does it aggregate data over periods of time? So
It can, yeah. Anything you want. In fact, it's aggregated here by the week, and that's just how we present it, so that it's not. Every day gets to be a little overwhelming. So you can aggregate it every couple days, weekly, monthly, whatever you want.
Okay.
Inside here, it's done weekly. If you needed something more or less, you can always contact us and get syndromic surveillance data from our syndromic surveillance program too.
Okay, so like if you wanted to compare years, say, certain season of the year, for example, if you wanted to look October through January, for example, or something like that, year over year for mental health visits, for example, you could.
We do that all the time. It's some manipulation. You wouldn't do it here usually. We don't have that much functionality in it, but there's a little bit of that functionality. But if you really wanted something really specific, again, you could actually request it through KDHE.
Okay.
Yeah.
Fantastic. Thank you.
Regarding that request, that goes to a general person at the Kansas Department of Health and Environment, or who does that request get directed to?
Actually, it's good if you know somebody. So if you know me, you can contact me, right? Because I know who to go to. I can tell you who to go to. Her name is Gabe. She runs syndromic surveillance. I don't have her contact information here. But usually if someone comes to me and says, I have a syndromic surveillance question, I say, here's Gabe's contact information, and she'd be happy to give it to you.
Beautiful, thank you.
It really helps to know who to ask, because we do get requests all the time for people, and they're asking me something. I don't know who to. Usually we can find out who you need to talk to. So for any data requests, you can contact me, and if I don't know it, I can give it to you.
Okay,
Okay.
and then will your information be listed somewhere?
I can give you my card. I don't know if it's on the, I can't remember if I put it in the PowerPoint or not.
Okay.
If it's not in the PowerPoint, I'll give you my card.
Perfect,
Okay.
thanks.
Any other questions? I think I'd mentioned the violent death reporting system. If we look at, these are the national data sources, of course the census. People try to use the census and ACS, the American Community Survey. They get frustrated. It's kind of hard to use. Again, it's more of a query system, so if you're not real familiar with how to pull that kind of data, it's not easy to use. But it is the basis for a lot of these data systems that we use, and they make it a lot easier to use. One that is available through the census that is easy to use, you just go to it, click a couple buttons and get stuff. Small area estimates of insurance. You can go right to this site and it'll tell you, insurance coverage for your county. Another one that they have, small area income and poverty estimates. Again, useful for demonstrating need in a community based on something like poverty or income. This is one you hear about a lot. It's not as useful to people. It's only at the state level. It's America's Health Rankings. You always hear Kansas is good or bad on this measure or that one. It usually comes from America's Health Rankings, probably because it's been around so long. It's not a government website. Actually insurance. I think it's insurance. United Health Foundation. But you hear about it a lot, and it's got a lot of good data, but it's only at the state level, so it's good for state-to-state comparisons. One that has state-to-state comparisons as well as a lot of county information is going to be the County Health Rankings. A lot of data here at the county level. It's a pretty good source. EPI sometimes a little iffy on it, only because there's some data extrapolation done, because it's really hard to characterize all counties, particularly in Kansas, because we have really small numbers. But for the purpose of rankings, they really want to try to get as much data for all the counties possible, so a lot of people use it. I won't go into why EPIs hate rankings as well. It's a thing. We just don't like rankings. But a lot of people do like rankings, right? Yeah, that's why we follow basketball and football and things like that. Who's ranked number one? It's a good source. There's plenty of good information there that you can use. If you're interested in social vulnerability of communities, social vulnerability index, which I have trouble saying, so I say SVI most of the time. You can get data on SVI by county or census tract, so you can really get down into a very small area for measuring things like you can get overall SVI, which is a measure of a community's vulnerability to, say, disasters, epidemics, other things like that. You can also get measures for housing, racial and ethnicity, household characteristics, and socioeconomic status. And this data is all downloadable, so it's pretty easy to use. It's CDC. They accept it as a legitimate source of information, even though those small area estimates can be tough to get to. They're modeled primarily. In addition to the SVI is the minority health SVI. They add two more categories to the four that I'd mentioned, healthcare infrastructure category and a medical vulnerability category. Again, if those are special interest to a group, you can use those, and again, you can get this down to at least the county level. Places data, this is a CDC site. It maps primarily prevalence and behavioral data. So this is where I say they steal our BRFIS data. It's really don't steal it because CDC, they fund us to take it. But we get the data. They also take the data and they will model it for small area estimates. So in the case where our BRFIS doesn't get all the counties, they will model the data for county and census tract and zip code for all kinds of chronic conditions primarily, as well as health-related behaviors. Some measures of social determinants. So it's a pretty good website to use. We always try to caution people to take too much from small area estimate based on models, because sometimes your model's based on zero sample. In other words, there was nobody in that small area that was actually asked any of these questions. It's model data. So be careful, but it's a pretty useful website. The data is downloadable. We can get you this and sometimes make something like this. I did this for one of our programs at KDHE. They were applying for a grant. They needed to know the relationship between chronic disease and SVI. So I just mapped the two, laid one over the other to identify the darkest blue census tracts in the state where there was the highest burden of chronic disease and social vulnerability. I won't say much about this one. City to health dashboard. If anybody's actually from one of these few cities in Kansas, there's good data on that. Otherwise, you're out of luck. This is the rural health mapping tool. This was developed to map COVID-19. Again, some really good information on here. The health information is a little sparse. It's mostly mortality based, but it's another one that can get you down to the county level. Environmental justice, what they call the EJ screen. This is EPA, so they mix environmental data, health data, socioeconomic data, and can map it by census tract. And so it's a good website. They also have the National Environmental Public Health Tracking. This website's interesting. You can show maps side by side, asthma, air quality, and see what's going on. Very similar to EJ Screen is the Environmental Justice Index. This is from CDC as opposed to EPA, but it's pretty much the same thing. You're mapping data, social, environmental, health-related data at the census tract level. Here's a map tool. This is a little different. It's not necessarily a lot of health-related data, but rather health shortage areas. So if you have a health professional shortage area, you can get the information here. There's other websites you can get this. You can get dental shortage, you can get mental health provider shortage from this website. They also have their own maternal and infant health mapping tool. If you can't get what from our state level data, you might be able to find some stuff on the national level, although we usually have more, of course. Yeah, go ahead.
Do those two go to census tract level, or are those just county level for the two HRSA that you mentioned?
These?
Yeah.
These will usually only be at the county level.
Okay.
Yeah.
Okay.
As are ours, our maternal child health, because it's a smaller number. That's the challenge. If anybody's interested in food environment, EPA has a couple good websites. The Food Environment Atlas, they can map things like restaurant density, particularly fast food restaurant density by county. They have another one that's similar, the Food Access Research Atlas. Again, they can map this low food access, low quality food access, and income and poverty all together, and they'll map that at census tract level. And a really easy to use site. This is not a government site. Anybody use Map the Meal Gap? Map the Meal Gap, I think, yeah. Feeding America, easy site to just go, click your county, boom, you got data. And it also provides some data at the county level for racial and ethnic groups, age, and things like that. So you can do adult child. This is the last one I'll show, just as a demonstration of when I was putting this together, and I was trying to think about, okay, what are the really good websites? There's more sites coming up every day. You can't even hardly keep up with the data, mapping, and government level sites that are available for use. So even if you've looked before and you said, I can never find data on this thing, wait a week and you might find it a week later. There's lots of stuff available. And if you can't find it or you don't know how to use it, I always suggest feel free to reach out to somebody that you work with, even Sunflower, KDHE, KHI, will all help you. And usually if it's a pretty simple data request, we can tell you either, yes, we can get it, and here it is, or no, that's not available. You're asking for too much. You're asking for the world, we can't give it to you. But we'll give you what we can. Are there any other questions? Like I said, we'll try to make this available to you so that you don't have to memorize those links that I had.
Sorry, Steve. I just was so appreciative of the comment you made the last Learning Collaborative about the importance of understanding the context of your data if you're trying to tell a story, a persuasive story with it.
Yeah, that becomes the challenge that some people have is that, what is the purpose for the data? What are you trying to tell? If you want to make the argument that we are an area in need, being able to use some of these, like the social vulnerability, along with, demonstrating that, use SVI, say we have a high SVI, plus we have a high burden of diabetes. Therefore, we really need, we're in need of funding for this particular program for whatever reason, and using that data to demonstrate when you write a grant that that's what you, that's why you need it, because oftentimes grantors are looking for that. Can you demonstrate that you really have the need in your community? Data is usually the best way to tell that story and indicate that yes, indeed, because you can say, well, we really need this because we want it. That's great, but can you prove it? And this is one of the best ways to prove it with data and reliable data.
Any other questions?
This is a general question about census tracts. I've seen that. I've looked at the Census Bureau website. I haven't dove into it deeply. How do they determine like the neighborhoods included, or is that customizable?
It's determined by the census in a way in which the population within that census tract is roughly of the same size, somewhat following a pattern that makes sense. So it's all contiguous. So one census tract is always going to be self-contained. It's not going to be in two different places. So the census tract here, I think the last time I looked, it was like 4,000 or 5,000 people in the census tract. So that's oftentimes how they define them. That's why you see some are bigger in western Kansas, but it's still it's a lower level than the county. But that's how it's done. And so they will change with changes in the census, but not very often. Yeah.
Please join me in thanking Steve for his presentation, and then we'll hand it over to Wyatt to get started.
Another reason, or the only thing I would add to what what Steve said, I have a colleague named Stuart, I'm sorry. Sometimes one of the benefits of the data for context purposes is to show how you compare to your neighbors or to other counties in the region. That's a way to contextualize whether your rates are high or low or good or relatively less good. If you have questions about county health rankings specifically, I'm the state team lead for county health rankings for Kansas, so I'd love to talk to you about it. All right, so my name is Wyatt Beckman. I'm a senior analyst at the Kansas Health Institute. I did include my contact information in the slide, but I'm kidding, I'm giving Steve a hard time. I'd be happy to hear from you, so would Steve. He'll share his contact information. I'm based at the Kansas Health Institute. This is our lovely building. We're here in Topeka. Yeah. Oh, I'm sorry, yes. Got it, okay. So I'm based at the Kansas Health Institute. This is our building. If you walk out this door, you go across the street, you'll walk straight into the state capitol. So if you've been to the state capitol, you've been right by our building. You feel free to stop by. We'd be happy to see you. We're a nonprofit, nonpartisan educational organization. We do lots of different things. The common thread through all of it is that bottom bullet, this idea of supporting folks like you all that are doing this work in Kansas and supporting meaningful conversations around tough topics like the ones we're going to have today about evaluating and leveraging data when you don't have any time or resources. And the thing is, I have some bad news. So the original title for this presentation, which they tweaked a little bit, and it kind of stole my thunder, I'll be honest. The original title was How to Do Evaluation with No Time and No Money. And the truth is, I don't think it's possible. I don't think you can do it with literally no time and literally no money. But I think it's absolutely worth it. And I know when we think evaluation, sometimes the image we have in our head is a 100-page report that cost $300,000 from an external organization, that can be great. That isn't the only way to do evaluation. And that's not the only picture of what evaluation can be. And today I'm going to have you walk through an exercise with me to think about evaluation for your specific nonprofit and see what that can look like. Before I dive in, I want to get a sense for where folks are at. How many people between now and the end of the year could set aside 50 hours for doing evaluation work? No one. Okay, 25 hours. 25 hours? Okay. That's like 3 full days plus another hour. All right. What about 10? Who could give me 10 hours between now and the end of the year? Okay? Is? Hypothetically, this is you doing evaluation work. How many hours could you give me?
Okay. So, thank you.
So how about 5? Who can give me 5? Okay. How many people can give me the next 25 minutes? Can you give me the next 25 minutes? If you give me 100% of the next 25 minutes, I promise we'll take your evaluation efforts forward. So what we're going to do is we're going to do a worksheet. And as Carly is helping pass this out, I'm just going to set the stage for how I think about evaluation and how I want you to think about evaluation. So, definition of evaluation: systematic approach to collect, analyze, and utilize data to better understand and improve a program. So key pieces: we've got to collect and analyze data or information. It's not just numbers. There's lots of sources of evidence, sources of information. We have to examine it. We have to find some way to make sense of it and understand it. It doesn't have to be really complex. You don't have to be running statistical models to examine your data. And the last step is we've got to use that data to make improvements. It's not evaluation if you're not trying to better understand your own work and trying to make improvements. That's one of the key differences between evaluation and research. When we think research, we're thinking generalizable knowledge that benefits a really wide range of folks. Other people can benefit from your evaluation, but it's fundamentally about better understanding your work and making improvements. So when I think about what's the key questions we're trying to answer when it comes to evaluation, it's these two. How do we know, and how do the people that you're providing this information to, how do they know that what you're doing is working? And how do you make what you're doing better? How do you improve it? Those are the two key questions. So as we're working through the worksheet today, have those questions in your mind. So evaluation can be really complex. The CDC, Centers for Disease Control and Prevention, this document is like 146 pages. So I think our max was 25 hours. If you want to use like an hour and a half of that to read this, you can. Has tons of really great details. This model is a good framework for thinking about evaluation. A couple things you'll notice. There's not a start and end point to this. It's a circle, because evaluation should be ongoing and embedded in your process. There's some standards to think about, and there's pieces here and there's guidance on each of these steps. Some key things that I want you to think about. Because remember, we're thinking about evaluation with no time and no money, with the handful of hours that you said you could think about this. Some key ideas. We can't evaluate what we can't describe. I imagine your work, your nonprofits are multifaceted, they're complex, they aren't linear, but you've got to be able to clearly articulate, here's what resources we take, here's the activities we do, and here's the outcomes we're hoping to achieve. You've got to be able to articulate that. Second one, you've got to match the design of your evaluation, how you're collecting and analyzing data, to your specific context. If you have a nonprofit of 2 or 3 people, your evaluation should look different than an organization that has 50 people on staff. Last one, as the circle nudges you to think about, make it an ongoing activity, not a one-time thing. I would rather you identify ways to collect and analyze and share evaluation data on a regular basis that you can do year after year than do one big evaluation effort once, get so burnt out that you never do it again. That's all the background I'm going to give you. Now we're going to dive right in to the worksheet. So everyone should have one of these. Got one of these. So if you want to take just general notes, there's a notes page at the very end. But otherwise, we're going to work through this one page at a time. Okay? So everyone grab a pencil, grab a pen, flip over your folder, however you want to get set up to work through this. While you do that, I'm just going to grab something that I should have grabbed earlier. All right. Okay. Everyone ready? All right. So the first step, we've got to describe what you're doing. We can't evaluate what we can't describe. So what I want you to fill out, very top, program, goal, and purpose. So this is at the high level. When you think about your nonprofit, we're not evaluating every single thing you do. Think about a collection of work, a bundle of efforts. Maybe you have an initiative focused on young mothers. Maybe you have an initiative focused on food insecurity. There's lots of things that go together into that. Think about what that program is and tell me at the very top, what's the goal and purpose of that program? The second step, what are the things, the resources, the person power, the time, the grant dollars, the staff, the space, what are the resources and inputs that go into that work? That's what you're going to put in resources and inputs. The next step, you're going to list the activities. So when we think about activities, this is literally what your team and you and your staff are doing. If I could take a video camera and put it high in the sky and look at what your program is doing, this is literally what you're doing. Not what you hope to do, but literally what does it look like? And what we're doing as we build this is we're building a simple logic model. So on this side, this is our resources and inputs, everything that goes in. When we have those resources and inputs, it allows us to do our activities. And if we implement those activities the way we intend to, we believe, and we have good reason to believe, that it will lead to the outcomes we're hoping to see. And if we combine all of those activities and all those outcomes, it sums up to that program goal and purpose. This is that logic that you're building and that you've got to have in place to create an evaluation. Because what we're trying to do is describe how we can take these resources and turn it into these outcomes. So I've told you what that next step is, outcomes. So this is where it might be what you're hoping to accomplish, but it should directly connect to those activities that you listed. So what's an example of what this can look like? Here's my hypothetical nonprofit activity, my program. So I have a nonprofit that focuses on food insecurity. So my purpose is to decrease hunger in our community, and we collect and we distribute non-perishable food. So the resources and inputs that I have 2 staff members, we've got some community donations, we got a local community grant, and we've got a food pantry storefront. And the activity example that I'm going to give you is we have a weekly food pickup event at the local churches. And the outcome that I hope that directly feeds into is decreased food insecurity. There's that logical connection. If I can get the food into their hands, I can decrease food insecurity. So examples of things that you can think about here is there a logical connection between those resources and inputs into activities and into outcomes? And if you see where one doesn't flow into the other, it's okay. Make an adjustment. Go back. This can be iterative. And I have extra copies, so if you feel like you want to start over, later you can grab a new copy and start over. Okay, so after we've described our program, we've got a good sense of what it does and what it's trying to accomplish. The next step, let's think about our evaluation component. So I want you to turn to the next page. We're on the green page now. So at the beginning, what's the overall evaluation purpose? So there can be many purposes for doing evaluation. It should do something along the lines of help you make improvements, better understand your effectiveness and your impact. It can help you make decisions about what you want your program to do, ways you want to expand, maybe ways you want to shift the work. It could help you understand new directions. But what's the general purpose that doing this evaluation, if someone said, why are you doing this evaluation? What's that answer? Then the next piece. All good evaluation is organized around answering evaluation questions. So we know what our program does. We can ask questions of that program. Example questions can start with things like how well, how many, how satisfied, what change did I see, those sorts of questions. So think about a question that you can ask of your program. You can think about questions in two big buckets. If it's more about the activities that you're doing, the what of your program, it's a process question. If it's more about the impact and the outcomes, we call those outcome evaluation questions.
You said if it's about activities, it's about a process question, and if it's about what?
So this is evaluation jargon. If you hear process evaluation, people are asking about those activities you're doing. If you hear the phrase outcome evaluation, it's about the outcomes. That's a one-to-one language. Typically, we say process for activities.
And sometimes impact evaluation is language that's used instead of outcome evaluation. Yeah. Those are used interchangeably often.
Yeah, thanks, Carla. So we've thought of a question. So what's our evaluation going to focus on is what we're thinking here. So now that we've got a question, what data, what evidence, what information would provide a good indicator that answers that question? What would tell us whether we're successful for that topic, that question that we're trying to answer? Then the last piece, where is that indicator information going to come from? And this may be data that you're already collecting. This may be things you already have at hand. If you're looking at some outcomes and in impacts, it could be secondary data that you can track over time. But where is that data coming from and what's the source? The source could be a survey. It could be sign-in sheets at your event. It could be internal tracking data. It could be observation. It could be an interview. There's lots of sources of data. So what's an example of this? So we're going to continue with my hypothetical food-focused nonprofit. Here's that example. So I want to describe and improve our current program operations and inform program expansion. So I'm really focused on the activities, that process. I want to know how well we're implementing those activities. So my question is, what populations are being reached by our weekly food distribution event at the local churches? An indicator that would tell me what populations are being reached is if I could collect data on the number of individuals that show up, and if I could break that down by different characteristics, by part of town, by race, ethnicity, by age. And maybe I already have some of that data from my program data, my distribution logs. Maybe I have a checklist that my event staff know who they expect to show up every week, and I simply mark who didn't show up. And that tells me who our program is reaching. Okay, we're going to keep moving. And if you feel like you didn't fully think through this, that's okay. You can take this home and keep thinking through these pieces. All right, the next section. So we've identified a question we're trying to answer. We've identified a potential indicator that would give us something that would answer that question. Now, who do we want to share that with? The first answer to this should be yourself. You should aim to use the evaluation data you're collecting. But there could be other audiences. But we're going to start with what's our goal? So again, what are we trying to accomplish with communicating this? So it may be to make some of those internal decisions. You've been wondering, should we go this way or that way with our program operations? It could be to increase community understanding of the work you're doing and the impact you're having. It could be for grant reporting. You may need to report on the effectiveness of the work you're doing. That can all be reasons to communicate your results. So the first step, who's an audience that needs to hear the evaluation that you're going to conduct? Think about yourself as an audience, your own team, your board, county commissioners, local partners, state agencies, local news organization that's trying to understand a topic that you've been working in. There can be lots of audiences here. But we start with audience because how we build the format, how we package that information can look different depending on who we're communicating with. When we think evaluation, the first format probably people think is big report. That's one option. It may be the appropriate option, but another format could be a slide deck. It may be a 10 slide deck that you can share with your internal team. It could be a memo that's only 2 pages. It could be a conversation with a partner over coffee. So think about what format you can share that information. And then that last piece goes with the format. What's the channel? What's the setting that you can provide that information? If your audience is your board, odds are you have a quarterly annual meeting, asked to be on the agenda, share your evaluation results. If it's a partner that you're trying to build a relationship with, maybe it's less formal than that. Maybe it's just a phone call and you set up a meeting. So let's look at an example, my example here. So my goal was I really wanted to inform our board members about, better equip them to make some decisions about our program. And I also hope that by doing that and sharing the results, I can facilitate some community engagement with the organization, that they can know what we're doing and the impact we're trying to have. But the example audience I'm going to show is our leadership board. Our leadership board isn't going to read a 10-page or a 20-page report with a lot of words, so I'm just going to do a 10 slide deck. I'm going to do a presentation, and I'll just go where they already meet at our quarterly board meeting. So some final tips, and then we'll have a little bit of time for any questions and we can revisit anything. So the first tip, start simple. Wherever you're at with evaluation, don't feel like you have to go all the way to doing everything possible and collecting every piece of data that's out there. Start with something simple and sustainable that you can manage and you can do really well. So start simple, you can always iterate over time and improve over time. Second idea, use what you have. Hopefully when you were thinking about data sources, you thought about data you were already collecting. And odds are you are collecting information and data. You just maybe have not been thinking about it as data and evidence. Odds are if you provide a service of any kind, you're probably tracking it in some way. Think about how you can leverage that information. You may have partners in your community that collect data that you can work collaboratively with. How many folks know of or work with in their community a community health assessment or a community health needs assessment? What if you have a question that can be answered by a survey? Maybe you can partner with your folks that are doing your CHNA or your CHA to get some of those questions added. They may have data in that effort that answers some of the questions you have. So use what you have. Don't go looking to add things until you already know what you have. I've already said this, I think, but I'll say it again. Don't collect data you aren't going to use. We are doing evaluation with no time and no money. We don't need to waste the little to no time and money we have collecting data we aren't going to use. And when you're talking with your partners or with your board and you start showing them data and they ask for more data, you should come back to this question. How are we going to use that additional effort, that additional data? What questions will it answer that we're not already able to answer? So don't collect data you aren't going to use. Next idea. Make your evaluation part of the work you're already doing. As much as you can integrate it into your daily activities, your weekly activities, and it doesn't feel like something separate, then that total number of hours you've got to commit to doing evaluation will come down. If you can find ways to leverage the sign-in sheet for your events, if you can find ways to leverage the reporting that you're already doing to your grant providers, make it part of the work. Last idea, know your audience. So an example I want to give for this idea. I'm from Ness City. It's in western Kansas, close to Hays. Anyone know of Ness City? Heard of Ness City? Okay, great. So Ness City, that's where I'm from. My high school class had 31 people in it. So if you were doing a program in Ness City, and in my high school senior class, you got 30 people to show up to that event, you would be crushing it, right? 30 of 31, that's phenomenal attendance. That's 90-something%. If I don't provide the context that that's out of 31, does 30 sound like a big number in Topeka or Kansas City or Wichita? Not at all. Your audience might not know that context. So think about when you're communicating your results, when you're communicating the work you're doing in general, what context do you know that your audience might not know, and how can you better help them situate and understand your results in that context? Okay, that's it. Any questions?
Wyatt, I have a question to maybe kick us off here. I'm thinking about, like, so if I'm doing evaluation and the audience for that is my board, and so I tell my board I'm doing an evaluation, in my head that creates a certain expectation that there's going to be information that we find that helps us understand, wow, we eliminated food insecurity. How can I set expectations about what can be learned from the evaluation we're conducting?
Yeah, that's a really good question. I would start as much as possible with building it around what questions am I trying to answer, and being really focused on that, and then going back to this theory of change, this logic model of here's what we're doing, here's the resources we're having, here's how we're expecting that to achieve outcomes, and have that conversation with your board. And odds are, if it's really big a challenge, there are other factors beyond the work your nonprofit is doing. But just being really focused on the questions you're trying to answer, and when you're saying, okay, we're going to start doing some evaluation work, maybe on the front end you say, we're not going to provide a 10, 20-page report. We will come back in 6 months and we'll provide an update and we'll provide a presentation so they know the level of data you're going to provide back. But I think putting your evaluation in context, I would use your theory of change and your logic model, so to speak, to help provide some of those bounds, and I would go back to what question you're trying to answer. And if they ask, how is our nonprofit, like, here's an example of a question that is not answerable and wouldn't make sense. It's an extreme example. How is our nonprofit solving or fixing climate change? It's like, our nonprofit by itself is not fixing everything. Or how is our nonprofit solving world peace? It's probably not doing all of that. But so how can we back that up to a question that we can answer and we could have data for that provides evidence to know if we're accomplishing it?
I love that. I think that's hugely important in setting expectations. We had a metric that came through recently on one of our reports that was at 50%. And we had to put that 50% into context because the population being served were unsheltered, had barriers to employment. Many of them didn't have IDs. So when you got 50% of those people employed after an 8-week program, and it was 40 out of 80, all of a sudden the context was different.
Yep.
But most people hear 50% and they go, 50%, that's an F, right? I mean, that was an F in school. So I love the 30 out of 31, and I love sort of thinking through that, because setting those expectations, regardless of if it's your board or it's some other council, or even when you're putting it on social media, trying to give enough context for that audience, which is going to be incredibly diverse and broad, but trying to give them enough to be able to anchor it to something, I think is really key.
Another thing, that's great, Brett, thanks. Another thing that I would mention, that I think can help provide some of that context, and is maybe a way to also have that conversation about the level of effort you want to have for your evaluation. Something that can provide context is year-over-year change. So you say, my hypothetical example, we reached 20% of families in my town with our food distribution site. How do I know if 20% is relatively good or bad? If I can compare it to other communities, but they may have very different contexts, but if there's similar communities, I can find secondary data, I can find partners, compare it to other communities. But a really good way is to track it over time. And the only way you're going to have that is if you design evaluation efforts that you can actually implement sustainably over time. So if I can say, we reached 20% of our population, we might want that to be higher, but if I can tell you that 3 years ago we only reached 5%, that's a different story. That's a different conversation.
So I was wondering, how do you gain sustainability? For example, like I just started in my position earlier this year, and so I'm kind of missing that context in my organization as what is realistic for us to implement when we're collecting data and stuff.
Yeah, I wish I had a really easy answer for you. I don't. How I would work through that is really be really critical, like self-critical and intentional about not biting off more than you can chew to start with. That's the biggest thing, the biggest risk we have, I think, with evaluation efforts in particular is there's lots of data out there. There's lots of potential questions we could ask. Be really intentional. What's the most important question? What's the most important indicators and data? And start with something you can confidently do, and you can say, could I do this again next year? And if the answer is no, there's no way, then try to find a way to pull back. But it's going to be much easier for you to do something and then go next year, oh, I can build on that, than to shoot for, this is not a situation, I don't think, where you shoot for the stars and land among the moon. If you shoot for the stars, you just get stranded in space. So like, know how far you can go reasonably and then keep going farther the next time. But I don't have an easy answer. I think it's a conversation, but that's how I would try to think through it.
This is maybe a question more about trends in this space. I'm curious about, because I feel like in the 2010s, funders really focused on like the logic model and the theory of change, and we put a lot of effort in developing those. And then as you were talking about it, I realized I don't remember the last time in the last few years a funder or anybody's asked for a theory of change or logic model. So I'm curious if you're noticing any trends in how some of these tools are used or not used over time.
That'd be a good question for other funders that I'd be curious to ask them. What I would say is, even if they don't ask for it, I think you'll design a better evaluation effort if you know it and you can explain it. I could provide, another way to say this, a really effective evaluation that I share might not have to include that, but thinking that through will probably lead to a better spot in your evaluation, because you'll be asking questions that naturally flow and fit in with that logic. And I like it as an exercise because odds are your nonprofit or your work is complex and has lots of pieces, but what we're trying to understand when we're evaluating is these connection pieces. And so you've got to be able to see those and describe them to then try to find indicators and evaluate them. That's what I would say, but I'm also not in a position where I'm providing grants. I'm not a grantor, and I can't speak really confidently from that position, but I think it's still helpful. I don't know if anyone else has thoughts.
Yeah, I mean, I would say I agree with the trend that you're naming, that trust-based philanthropy moves us in some ways away from a more comprehensive evaluation. And I think there's still, and again, I'll provide the same caveat I provided when I introduced myself upstairs. I started about a month ago. So there should be quite a bit of salt on these comments. And I think there's still value in understanding what evaluation means to an organization, and what if it doesn't have meaning to you, to quote Wyatt, then it maybe doesn't have meaning. So I think it's more about what does evaluation contribute to our organization, maybe more so than how it was perhaps in the past, where it's like what evaluation or what degree of evaluation intensity does my funder require? Question over here.
If I can just riff off of that, and I just want to say what a fantastic job I think Steve and Wyatt have done here. Thank you so much, and I love this model and handout that you've given us. I think funders forever and always are going to be seeking that information about impact, right? What is the impact? And so working your way through this kind of logic model, this theory of change, if we do this, then this will happen, is going to help you in whatever way you're conveying that to your potential funder, foundation, corporate, whatever. In addition, it's going to help you attract partners because you can articulate to them what's the value of your organization, what's the impact your organization is having. So it can be very persuasive in that realm as well.
I'm noticing we're very close to a time boundary, so I'll maybe put a call out for if there's a final question.
I just want to, I have a comment. In regard of these evaluations, thank you so much for letting me know that it will be according to my questions and according to me. Like for example, we did an evaluation for last year and we presented it to our board, but we didn't have anything to compare it to. But we're going to do it again this year, and then we're going to start comparing it. Now, in regards of collaborations, like for example, why should we do an evaluation on a program that we are not hosting, we are just collaborating? Like for example, with the Kansas Food Bank, we collaborated with them, we're hosting a food drive. But that you made me think that my evaluation will be, how am I doing with my volunteering persons? Are they coming? How many are they coming? How many hours are they spending with us? So yeah, evaluation is not only one way. You can have many, you can answer many questions, and I will have information to go back to, maybe to do a bigger report. So yeah.
Thanks for the
Thank you.
And what I'm hearing is you're thinking about really how can I use the information I'm collecting, which I hope is a big message that came through. And you can do exactly what you said. If you can start small with maybe the really careful about sustainability, and maybe after 5 years of collecting that data, you do a 5-year look back that is a big report that you share with your funders. There's different ways to combine it. Last thing, and my comms director would be mad if I didn't do this, that's our website. Check us out, khi.org, we're the only one. If you Google khi.org, you should find us, Kansas Health Institute. We're on all the social medias, and I won't be here tomorrow, but a couple of my colleagues will for the connector piece and the partner pathway, so please stop by the table if you'd like to learn more about KHI. There's plenty of extra handouts too. If you want to take one, feel free to.
Final thought, Wyatt also has an excellent podcast called Health on the Plains that tells the stories of community health in thriving rural Kansas. So would personally recommend that podcast for you as well. But please join me in thanking Wyatt for his time today.
And we just dropped a new episode today, so go check it out.